Hello, I'm Dr. Madeleine Attridge. I'm a GP partner with some out of hours experience. I've been asked to talk to you today about the management of otitis media by remote consultation. So first of all, in all of my sort of telephone consulting, I try and ask to speak to the patient first before I introduce myself, just due to a confidentiality point that the patient's relative or friend might not realise that they've actually called the doctor in the first place. I then make sure I've documented that I've actually checked the patient's name and date of birth before we start. I try to speak to the patient themselves if they're able, just because I get a better idea of how unwell they are. So then I start by asking a detailed history, because you're not actually seeing the person necessarily. You need to get a bit more information and document as though you'd seen them. So I want to know how long they've had ear pain for, how severe it is, if they've got any fever, any discharge, any itching, because itching might imply this is more likely to be otitis externa. Have they got a history of recent common cold symptoms or a history of recurrent ear infections or surgery? And it's important to always ask, have they got any facial weakness or numbness and things like that, things that would make me a bit more alarmed that actually I do need a face-to-face assessment with this person. This advice obviously only applies to sort of otitis media. So this is the sort of typical patient where it's the parent phoning up with a young child who's had a fever recently or common cold symptoms and then has earache now. This wouldn't necessarily apply if you're getting the history that's a sort of older patient with earache and no sort of common cold symptoms. Then you're going to need to work out this could be more likely to be otitis externa or wax. So you may need to see them in that situation depending on the availability. So getting a bit more history about the otitis media. So I want to find out if the patient's systemically unwell. So if it's a child, I'll be asking the parent, what's the child doing at the moment? Are they playing, or are they just very lethargic, lying on the bed, not willing to do anything? Because that's going to be sort of an alarm feature. This child could be quite unwell with this and might need a face-to-face consultation. I'm also going to ask what the carer or patient wants out of the consultation and what they're worried about. So a lot of the time they're just worried, is it an infection? And I'm going to say, well, it probably is, if they've had a history of, ear infections in the past, common otitis media in the past, this is probably otitis media again. But, a lot of the time we don't give antibiotics for that sort of indication. And then I'm going to go on and do what examination I can on the phone or the video. So I'm going to ask them, is there any sort of redness coming down the side of the face, any obvious swelling at all? Can they see any discharge? And I often ask them if they can press on the bone behind their ear and make sure they press all the way from the top to the bottom, because they often don't quite know where you mean. So if you just press all of that area, and then they can describe to you. Now, sometimes I might need to link into a video consultation just to check they're pressing in the right area, because it is important to exclude mastoid tenderness as well. So then you need to make a diagnosis based on the history. That is this, very likely otitis media, with the classic sort of case of earache in the young child who's had recent cold symptoms or fever? Or is it, an older patient who has a history of otitis externa, and this has they've got their sort of same symptoms of discharge and itchy ear and mild pain but no fever? Those with otitis externa, you could make a plan that they can sort of start some acetic acid spray, or they can be reviewed in 2 days if it doesn't improve. If you're going to give topical antibiotics over the phone, I'd probably go for sort of ones that are less ototoxic, like ciprofloxacin. There's also the other differentials like wax, or even sort of dental problems can cause earache as well. So in the older person, it's a bit less clear, but your typical young child with earache can be managed over the phone, at least for the first 2 days typically. So in the sort of shared decision making, you're going to discuss with the patient or their carer that this is generally a self-limiting condition. It's caused by the common cold virus. Most get better within the first 2 days. In fact, 4 out of 5 are better within 48 hours. the rest are better mostly within 5 days. You're going to discuss about when antibiotics would be appropriate, because often they'll know somebody who's had antibiotics and they'll be like, well, they had them and I haven't, so you're going to talk about ones where they're discharging. It might be appropriate then. If they're painful despite taking max pain relief, it might be worth giving antibiotics in those scenarios. Those under 2 or with bilateral ear symptoms, we have a very low threshold to give antibiotics then. And if they're no better after 2 days, it's worth them re-reviewing with you. And those with recurrent ear infections or surgery, we're going to be more likely to give them to them. Okay, it's then important to safety net that if things don't get better by that sort of 2-day point, or even by 5 days, they need to ring back. If they've got any features of being sort of systemically unwell, then they really need to ring back. And if you've prescribed antibiotics and they're not working after 48 hours, they need to ring back. Now, a lot of the time parents aren't sure when to seek advice from the doctor, and they're not sure that they should phone you up every time their child has a tiny earache. They just don't want to miss anything, and they spend quite a lot of time worrying and getting very anxious at home that they might have caused their child some damage to their ear if they haven't got them seen and things. So I find this leaflet quite useful just to reassure parents of when they should see us. It goes through all the sort of common conditions that children have in the first few years. So I often give it to sort of new parents with their first child, or people who just seem quite anxious. You can, if you're doing things over the phone, you can text them the link, or you can read out the sort of web link to them. It's quite easy to find. It tells parents exactly how long each condition typically takes to get better. So, for example, coughs, they're often worried that the cough is still there, 2 weeks later, but actually seeing the leaflet, they'll see that's normal. And it tells them exactly when they need to be seen. Okay, so just to sort of recap again, for otitis media, it's important again to make sure you've got the correct patient, make sure you take a thorough history and document all of it. Make sure you really are dealing with otitis media and not something else, so you're dealing with the right thing. If it goes on longer than sort of 2 days and it's not improving, and you've only managed it over the phone, you might need to see them just to confirm the diagnosis, because most otitis media should get better within 4 days, remember. And it's important to do thorough safety netting.